Welcome to the deep dive. Today, we're looking at something that's probably way more important than most of us realize. What actually happens right after you leave the hospital?
Right, that moment. It feels like, okay, done,
Yeah.
finish line, you've had the treatment, you're going home.
Yeah.
But, the sources you gave us, and there's quite a range here, from global standards like JCI,
Mhm.
national ones like NABH, insights from healthcare consultancies, Suprematic was one, and just practical patient guides. They paint a really different picture.
And that's our mission for this deep dive. To really unpack all that material, we want to pull out the essential stuff, the crucial insights about actually following those hospital discharge instructions diligently. Because what all these sources seem to agree on is that leaving the hospital, that's not the end. It's really just the start of the recovery phase, a really critical start.
Yeah, and a core issue that pops up again and again in the sources
Yeah.
is this. Patients are often just understandably focused on getting home.
Yeah.
But they might not fully grasp or maybe just don't consistently follow these really vital instructions. And that lack of follow-through, well, the sources show it leads to some pretty significant problems later on.
Okay, so let's dig into that first. Why is this post-discharge time, this phase after you leave, why is it so absolutely critical based on what we're seeing in these sources?
Well, they're super clear on this. Getting discharged doesn't mean the medical care stops. Not at all.
Right.
It's really the beginning of this, active recovery period at home where what you do directly shapes how well and how quickly you heal.
And there are some numbers associated with this, aren't there? Pretty striking ones.
Yeah, they highlight one statistic that honestly is pretty concerning. Almost 20%, 1 in 5 patients ends up back in the hospital within just 30 days.
Wow, 1 in 5 back within a month? That's a lot.
It is. And the sources, they often point the finger directly at poor adherence to those discharge instructions as a major reason.
So not following the plan.
Exactly. The sources talk about the discharge plan like it's a carefully constructed roadmap to healing. That's a direct quote, basically.
I wrote that, okay.
And if you sort of veer off course, as one source put it, you're not just slowing things down, you're genuinely increasing your risk of complications, extra costs, and just a much longer, tougher recovery.
So these instructions, they aren't just like friendly suggestions.
Oh, absolutely not. The sources are really firm about this. They call them things like critical steps to full recovery or even personalized medical orders, not suggestions.
Medical orders, okay, that's a strong term.
It is. It emphasizes that this isn't casual advice. And failing to follow them, it's not just inconvenient. It can directly cause readmission, seriously delay healing, or, in the worst cases, lead to life-threatening complications. That time at home, it's just as vital as the treatment you got in the hospital.
Okay. So the stakes are high. We get that. Now, what exactly is in this roadmap? When you get that folder of papers as you're leaving, what are the main things you really need to focus on?
Right, so the sources usually break it down into a few key areas. Top of the list almost always is medication management.
Makes sense. Meds.
Yeah, it's crucial. Knowing exactly which meds to take, the right dose, how often, but also understanding why you're taking each one and what side effects you might need to watch out for.
Okay.
And they really stress this point. Never just stop taking a prescribed medication without talking to your doctor first, even if you feel better.
Right, don't self-adjust.
Exactly. And a practical tip they often mention is getting those prescriptions filled immediately, like same day if possible, maybe even on the way home.
Good tip. Okay, meds are number 1. What else is usually covered?
Activity restrictions. This is a big one, especially after surgery or certain injury.
Yeah, right, like how much you can lift or...
Precisely. Limitations on weight-bearing, lifting. Often there are rules about driving too, especially after anesthesia. Usually no driving for 24, maybe 48 hours. And it's also about gradually increasing activity. Not doing too much too soon because that's risky, but also not being too inactive for too long, which can slow things down too. Finding that balance they recommend.
Got it. Managing movement. What about, say, if you had surgery, the wound itself?
Yep. If that applies, you'll get a detailed wound care protocol.
Yeah.
This covers things like how often dressings need changing, maybe what specific supplies to use, and how to keep the area clean and dry based on the instructions. And really importantly, it tells you how to spot signs of infection.
Like what kind of signs?
Things like increasing redness, swelling, maybe the area feels warm, or if there's unusual discharge. And critically, what to do if you see those signs.
Okay, super important. Does diet come into play often?
Yeah, dietary guidelines are pretty common. especially if the procedure involved your digestive system or if you have underlying conditions like diabetes or heart issues.
So what you can eat or drink?
Exactly. It might mean restrictions on certain foods or maybe fluids, or sometimes it's guidance on making sure you get enough nutrition to actually help the healing process. Occasionally, they might mention watching for trouble swallowing.
And those follow-up visits, are they usually in there too?
Oh, definitely. Follow-up appointments. The sources are clear.
Mhm.
These aren't optional. They're a mandatory part of the plan.
Right. Not just a suggestion.
Not at all. They even recommend trying to get those appointments scheduled before you leave the hospital, if possible. And a good tip is to prepare for them, jot down any questions you have or things you've noticed during your recovery.
That's a lot to take in, especially when you're probably tired and just want to get home.
Right.
What about knowing when things are really wrong, the emergency stuff?
That's the last piece, and maybe the most critical. Recognizing and reporting problems, emergency signs.
The red flags.
Exactly, the red flags. The instructions should list specific symptoms that mean call your doctor now or even go back to the ER.
Can you give some examples?
Sure, the sources mention things like sudden difficulty breathing, chest pain, bleeding from a surgical site that just won't stop with pressure, a high fever like over 101 Fahrenheit that isn't coming down, sudden severe pain that's new or worsening, new confusion or serious dizziness, or if you just can't keep fluids or your medications down. Knowing these is crucial, could literally save your life.
Okay, so that's the map, pretty detailed, covering meds, activity, wounds, diet, follow-ups, and those critical warning signs. Now, given how much is involved and how vital it is, what are the proactive things, the do's? What do the sources say you should actively do to make sure you stick to the plan?
Right, this is where you really take ownership. The first big do is engage at discharge. Don't just nod along in that meeting.
Be present.
Totally. Ask for the instructions in writing. And this is important. Ask for a copy of your actual discharge summary. That's the official document listing your diagnosis, the treatment you had, and the next steps.
Okay, get the summary too.
Yeah. And before you walk out, actually sit with a nurse or doctor, go through the instructions point by point, ask questions. Don't feel silly if something isn't clear. Oh, and when you get your meds from the pharmacy, check them against the list you were given at the hospital. Make sure it all matches up.
Okay, so be really active in that final hospital interaction. What about once you get home?
Create a plan and use tools. The idea is to turn those papers into something actionable.
Like a schedule.
Exactly. Maybe a written medication schedule. Put appointments on a calendar. Have emergency contacts handy. And the sources suggest using tech too. There are tons of medicine reminder apps now. Save the hospital helpline number or the nurse's number if they gave you one. Make it easy to follow the plan.
Right, translate it into your daily life. What else?
Another key do, monitor and document. Keep a simple log or journal.
What kind of things do you write down?
How you're feeling each day, any symptoms, good or bad, your progress with activity, maybe questions that pop into your head for your next doctor visit. It's super helpful later. Keep that list of red flag symptoms somewhere visible, like on the fridge. And if they told you to track things like temperature or blood pressure, do it diligently.
That log sounds useful for the doctor, but maybe also just for you to see how things are actually going.
Absolutely. It gives you objective feedback. Also, organize information. You know how easy it is to lose papers when you're not feeling great?
Oh, yeah.
So scan them, save digital copies if you can, or at least have one dedicated folder or binder for all your discharge stuff. Keep that map safe.
Don't lose the map. Makes sense.
Right. And leverage hospital resources. Many hospitals have discharge planners, patient portals for messaging your doctor. Ask about those. See if things like visiting nurse services are an option in your area, especially if things are complex. These services exist to help you manage that transition.
Okay. And the last do, probably the most basic.
Communicate. Just ask questions. If anything feels unclear or confusing about your meds, symptoms, what you can or can't do, call your doctor's office or the nurse line. The sources make it really clear. It's so much better to ask what feels like a simple question than to guess and potentially make a mistake. They expect you to call.
Okay, that's a solid set of do's. Engage, plan, document, organize, use resources, and communicate. Now, for the flip side, this is where it gets interesting. What are the common mistakes? The don'ts that the sources warn about? the things that really mess up recovery.
Yeah, the pitfalls. Probably the biggest one the sources mention again and again is what you could call the I feel fine syndrome.
Ah, yes. I'm feeling better, so I must be better.
Exactly that. You start feeling a bit improved. So you think, maybe I don't need this last dose, or probably skip that antibiotic, or I feel good enough to go back to work or lift that heavy thing.
I can totally see people doing that.
It's super common, and according to the sources, super risky. They warn it can cause a relapse, meaning the original problem comes back. If it's antibiotics, stopping early contributes to antibiotic resistance.
Right, that's a huge public health issue, too.
Huge. Or it can just cause new complications or really delay your overall healing. You might feel okay on the surface, but the internal healing process might still be going on, still be delicate.
So that feel fine thing directly clashes with the do of monitoring and documenting, doesn't it? If you're keeping that log.
That's a great connection, yes. If you're actually tracking things, you have a more realistic picture. It helps you resist that urge to ditch the plan just because you had one good day. It reinforces sticking to that gradual increase in activity we talked about, not suddenly jumping back into heavy work or planning a big trip too soon. That's another specific don't. Resuming strenuous activity or travel prematurely often leads to setbacks.
Okay. What about those follow-up appointments we said were mandatory?
Missing follow-up appointments. That's another major pitfall. It's easy to think, I feel fine, why bother?
Yeah, skip the hassle.
But the sources stress that your doctor might spot subtle signs of a problem that you would completely miss. Skipping the appointment means you lose that safety net, that chance for early detection before something small becomes something big.
So it's another layer of monitoring, really, just like tracking symptoms at home.
Precisely. And linked to that is ignoring new symptoms. The sources are really emphatic here. If something new or unusual pops up, or something just feels off compared to how your recovery should be going, don't wait and see. Call the doctor. Visit if necessary. Delaying could mean missing a critical window to intervene.
Don't just hope it goes away.
Exactly. Don't tough it out. Report it.
Are there other common mistakes mentioned?
Yeah, a few others come up. Things like caregiver overload the patient or the family member trying to manage everything alone without asking for or accepting help when things get tough.
Trying to be Superman.
Kind of, yeah. Then there's just general communication breakdown, simply failing to report concerning symptoms back to the medical team. Sometimes it's financial shortcuts, like skipping meds or therapy because of cost, but without actually talking to the doctor or pharmacy about possible alternatives or assistance programs. And like we touched on with organizing, simply misplacing the documents, that can cause real problems later for ongoing care or even insurance claims.
It sounds like a lot of these don'ts boil down to either like overconfidence about recovery, maybe underestimating the plan, or just not reaching out for help or clarification when needed.
That sums up the common threads really well, yeah.
This really drives home that recovery isn't just the patient working in isolation. There's a whole support system involved, or at least there should be. Let's talk about that human element and also how this connects to the bigger healthcare quality picture mentioned in some sources. How vital is that support network?
Oh, it's absolutely crucial. The sources really emphasize bringing family or friends into the loop, especially, they note, for patients who might be elderly or very dependent or recovering from something really serious. In those cases, family members often have to take the lead. Taking the lead how? Helping create those schedules we talked about, setting medication reminders, maybe helping prepare meals that fit the dietary guidelines, arranging transport, or even proactively organizing things like physiotherapy at home, or finding home care support if it's needed.
So it's definitely not a solo effort for the person recovering.
Not ideally, no.
Yeah.
The sources often frame recovery as teamwork. It's a partnership between the hospital team, the patient, and their family or support people. And they make a good point. Even if the patient seems pretty independent, having that support helps ensure the instructions are followed consistently, especially since some advice is about preventing problems, not just reacting to them.
So getting support could mean practical things, too.
Yeah, like designating one person as the main recovery buddy for check-ins, maybe using meal delivery if cooking is off limits, or sorting out rides to those follow-up appointments way ahead of time.
Okay. And how do those sources that mention bodies like JCI and NABH fit in, the accreditation ones?
Ah, right. That gives us the important wider context. Organizations like Joint Commission International, that's the global one, and the National Accreditation Board for Hospitals and Healthcare Providers, which is specific to certain regions like India, they exist to set really high standards. Standards for quality of care and patient safety in hospitals.
And discharge planning is part of that?
A major part, yes. Effective, safe discharge planning is a key component of what these bodies look for when they accredit a hospital?
So a hospital's focus on quality, its accreditation status, is actually tied to how well they prepare patients for this transition home.
Exactly.
If a hospital wants that stamp of approval, they need solid discharge processes. And the sources that mention consultancies like Supremedic helping hospitals with NEBH accreditation or operational improvements, that just shows it's an industry focus. They're helping hospitals meet these benchmarks, which includes getting patients home safely and effectively. And related stuff, like blog posts on managing chronic diseases or finding therapy services that points to the whole ecosystem of support and information that's needed after the hospital stay for long-term health.
It all connects.
It really does. The standards, the hospital's actions, the external support networks, and what the patient and family do, it's all geared towards that same goal: better, safer patient outcomes.
Wow. This has been a really thorough deep dive. We've pulled together threads from all these different kinds of sources, standards, advice, consultancy, insights. We've seen why following discharge instructions is so critical, not optional at all. What those instructions actually covered, which is a lot.
The concrete do's, the steps you can actively take. The common don'ts, those pitfalls to watch out for. And how crucial support is, all situated in that broader healthcare quality context.
Yeah, I think the single biggest takeaway, the message that echoes across all the material, is just undeniable. Your medical care doesn't stop when you walk out the hospital door. It continues intensely at home.
Right.
And being really diligent about following those personalized medical orders is probably the most powerful thing you can personally do to avoid bouncing back to the hospital, to dodge complications, and just get yourself or your loved one back to health as smoothly and quickly as possible. It's about actively participating in that next phase of healing.
And knowing all this, it really does empower you, the listener, to take more control of that recovery path.
Absolutely. Which, leaves us with a pretty significant question to maybe mull over after this deep dive. Considering everything involved, the structured care inside the hospital, and then the often messy reality of managing recovery at home, how can we, both as patients and as caregivers, get better at bridging that gap? How do we make sure that the continuity of care, the support, is just as strong and reliable outside the hospital as the treatment was inside? That feels like a really crucial challenge, doesn't it, for everyone involved?